That was the first reminders that we are going to be recording this session so we can share it with people that weren't able to join us this evening. We always start every webinar and every meeting with our mission and our vision. Our mission is working together to eliminate serious harm across all children's hospitals. And our vision is all kids, all hospitals, all safe. I just want to go through a couple logistics with Zoom in case you're not familiar with Zoom. We are going to use a couple features, so we'll go through those real quick. If you need help or you want to communicate with us, you have questions of any type, you can put them in the chat. It's the one that looks like a little word bubble, and you can ask for technical assistance as well. If you want, we'd love to know your name and what hospital you're representing. And so to do that, you can click on the participant list. You right click on it and look for your name, and there will be three dots, and you can click on that and rename and just put a comma and then the hospital after your name. The chat box we've already talked about. So you can chat to everyone, or if you want to send something to just me directly or Teresa or Nicole or anyone else, you can click on their name. We'd love to see your faces. I see a lot of you and I see some familiar faces too. So thank you for joining us. But you can click on the video. It looks like a little camera to start your video. We're going to use a couple features. One is polling. We have an icebreaker coming up next where we'll ask you to rate a couple of answers to a question. And then we'll have some audience participation. You're welcome to use the reactions. I saw some people already have done that with the hearts and the claps. So thank you for that. And then the chat box, which we've already talked about. The response buttons you can get to by clicking on the three dots at the bottom for more, and you'll see reactions. So now we want to do a quick icebreaker. We have a question for you all. What helps you feel safe when you first arrive at your children's hospital? And the items that you can select from are a warm greeting, clear explanations, staff working together, a clean space, or being asked questions about you or your child. And we'll give everybody a few minutes or a few seconds to respond.
All right, Missy, we're about 60% of the way there of our participants submitting, so let's give it another 10 seconds.
Okay. The voice you just heard is another key member of our team. Her name's Jessie, and she helped with all the planning, and she's our technical guru and is helping us out with all the cool features of Zoom.
All right, thank you, Missy. And then we'll go ahead and close the poll.
So it looks like a warm greeting was the winner there, with a close second under clear explanations and being asked questions about you or your child, and then staff working together, and then a clean space. Thank you for doing that and for answering. And then with that, we have our first gift card drawing, which we randomly selected names earlier. And I'm going to read off two names for the first drawing. And if your name is called, please put your name in the chat so I know that you're here. We want to give gift cards to the people that are attending today. And so each drawing is a $50 gift card to Walmart. And we're going to give away 10 of them this evening. So the first winner is Maggie Chisholm, and she's representing Cincinnati Children's Hospital. And the second one is Dara Murphy, and she's representing Cleveland Clinic Children's Hospital. So thank you for that. And I want to introduce one of our guests this evening, and her name is Bimpe Adaleja, and she's a patient and is going to share what safety matters to her. So Bimpe, please welcome. And thanks for sharing your story.
Thank you. Hi, everyone. So, what does it mean to feel safe as a patient? When we talk about patient safety, most people think about preventing falls, avoiding medication errors, or responding to emergencies. And all those things matter. But for me, safety means something deeper. It's not just about being physically safe, it's also about being able to trust the people that are responsible for my care. So I was born in Nigeria and I moved to the US when I was 6 years old. And growing up, I always felt like something wasn't quite right with my body. I was constantly tired. I couldn't keep up with my classmates, especially in gym class. And I had all these episodes of intense and unexplained pain all over my body. And at the time, my family didn't have health insurance, so we just managed the symptoms the best that we could with over the counter medications, but we didn't have any answers. And everything changed the summer that I turned 13. I had the worst pain I'd ever experienced. It felt like needles stabbing me all over my body, and it lasted for days, and nothing helped. Eventually, my parents took me to the emergency room, and that's where I was diagnosed with sickle cell anemia. I remember my mom and the doctor looking really sad, but I just felt relief because I finally knew what was going on with me. From that moment on, my care team at Children's Hospital completely shaped my understanding of what safety feels like. In the US, sickle cell is usually diagnosed at birth, but that wasn't my experience since I was born in a different country. Because of that, the first few years after my diagnosis were very challenging. But through all that, I felt supported, I felt heard, and most importantly, I felt safe. I knew they had my back. I knew that I could reach out at any time and they would help me figure things out. And when you're living with a chronic illness, that kind of trust means everything. And that experience stayed with me. And when it was finally time for me to transition to adult care, I didn't want to leave. I had built relationships with providers that really knew me, not just my condition or my diagnosis, but me as a person. And because of that impact, I kept finding ways to stay connected throughout the years. First, I volunteered at the hospital while I was in college, and then I eventually worked with my old doctors as a research coordinator after finishing my master's degree in public health. And now, through working with the Family Advisory Council, I can use my experience and my voice as a patient to advocate for others. That environment showed me what healthcare should look like and what it should feel like. But I didn't fully understand safety until I experienced what it felt like to lose it. As a freshman in college, I was pre med and I was very excited to shadow a physician for the first time. I'd gotten rejected many times before, so I was finally grateful when I got someone to say yes. I was eager to learn and a little bit nervous, but the day was going well. I'd gotten to observe several patient appointments and I was feeling inspired and like, this is what I want to do with my life. And near the end of the day, we went into the physician workroom and a few doctors were talking casually. One of them asked, "What's your least favorite group of patients?" The doctor I was shadowing responded, "Sickle cell patients. They're really complicated and they just need so much, and I just don't like them." And in that moment, everything shifted. They didn't know I was a sickle cell patient, but I did. I could feel my heart drop. I'd heard these stereotypes before, being labeled as drug seeking or difficult, but this time, this was the first time I heard it so directly in my face, in a space where I was trying so hard to belong. And in that moment, I felt unsafe, not physically, but in a deeper way. Because if a provider sees patients like me as a burden, how can I trust them to care for me? And how will that bias influence the care I receive? And how many other providers think the same way? And what does that mean for the decisions that they make about my care? Another time I felt unsafe was during a hospital admission for a sickle cell crisis and pneumonia. My hemoglobin was dangerously low, and because of my weak immune system, my body was struggling to fight off a lung infection. I had an IV pump for pain management and for my blood transfusions, but it kept beeping because it was right in the crook of my elbow. So every time I moved my arm, it would beep. And one night it started going off loudly while my mom was passed out on the couch after a long day of work. She always made it like her mission to come see me every night so that I wouldn't have to spend the night alone in the hospital. And so I knew she had to get up early the next day for work. So to avoid waking her, I just clicked on the silence button, something that I'd done many times before with nurse's permission. But this time, the nurse came in immediately and started yelling at me, "What are you doing? You're not allowed to touch that. If you keep doing that, we're going to take away your access to pain meds." And I apologized immediately. And then the next day, I found out that she had told all the other staff that I was trying to manipulate the pump to get more pain meds. And that wasn't just incorrect, it was impossible because in order to change the meds, it requires a physical key as well as a badge swipe and sign off from two nurses. But more than that, it was harmful and it could affect how other staff and providers viewed me. I felt angry. I felt humiliated, judged, labeled, and most importantly, I felt unsafe because now I wasn't just a patient in pain anymore. I was being seen through a lens of suspicion. And when that trust is broken, it's very hard to rebuild. So when I think about safety, I think beyond physical protection. Safety might mean preventing medical error, harm, falls, and injuries, or it could also mean being in a secure place that maintains proper infection control, emergency preparedness, and health standards. But it also means feeling respected and free from judgment and being cared for, supported, and treated as a person, not just a diagnosis or a stereotype. Safety is multidimensional. It includes physical, psychological, and environmental components, all of which are important. So, what can healthcare systems do to create safe environments for patients? We need to actively address bias and stereotypes in healthcare, especially for conditions like sickle cell. Build trust through consistency and respect. Communicate with empathy and compassion, even in stressful moments. Create a culture where patients feel respected, heard, and valued, not judged. And hold each other accountable for how patients are treated, not just clinically, but also personally. And create policies that protect both the patient's physical and psychological well being. Because safety isn't just built through protocols, it's also built through people. Safety directly impacts outcomes. When a patient feels safe, they speak up, they trust their providers, and they engage in their care. But when they don't, they hesitate, they withdraw. And when safety is compromised, it can lead to fear, mistrust, and avoidance of care altogether. And that can have real consequences. For patients like me, safety isn't optional, it's essential. My journey as a patient has shaped how I understand safety, not just as meaning the absence of harm, but as the presence of trust, respect, and compassion. My experience has shown me both sides of healthcare, what it feels like to be truly safe and what it feels like when that safety is taken away. And that's something that a patient never forgets. Every patient deserves more than just treatment. They deserve to feel safe in every sense of the word. And every interaction is an opportunity to either build trust or to break it. So the question is, what kind of environment are we creating for our patients? Thank you.
Wow, Bempe, thank you so much for sharing your story and making us all think about safety a little bit differently, maybe. Thank you for sharing your story. I can't thank you enough, I guess. I want to go ahead and turn it over to Laura Wood, who's going to talk with some parents and some patients about safety as well. But before we do that, we'll do our second gift card drawing. And we have one winner for this one, and it's Esmeralda Carroll, and she's representing Texas Children's Hospital. So Esmeralda, if you're on and you could put your name in the chat, we'll make sure to get a gift card to you. So thank you, and I'll go ahead and turn it over to you, Laura.
Thank you so much, Missy and Bempe. Wow. What a gift for you to share your story. That is a vulnerable story to share. And I hope that you'll take a few minutes to look at the chat and just see the love and appreciation for you really opening up, not only to share the journey, little bits of the journey. We know that there is much more to your story than you could ever share in just a handful of minutes, but also the work that you are doing to advocate for progress that makes a tremendous impact. And so just huge gratitude to you. So, for those that I haven't met before, I am Laura Wood, and I have the great pleasure of serving as the Senior Associate Clinical Director on the Children's Hospital's Solutions for Patient Safety Clinical Leadership team. And I am just so honored to get to spend the evening with the group of you. There's an amazing group of folks that you're going to get to hear from firsthand, but huge appreciation to everybody who is setting aside the time to join us this evening and for the work that you do every day. In the Solutions for Patient Safety world, over the last few years in particular, we have been really appreciating the importance of learning differently in order to improve how much we're able to progress in terms of safety in our hospitals. And fundamental to learning differently is really going to the experts who know best. And what better way to do that than to spend some time talking with a group of you who have extensive expertise through your own personal and family journeys in terms of safety and healthcare. And so just thrilled to welcome Kimberly and Andre and Cody and Hannah and Jeremy to be able to learn from your wisdom and your experiences. And so thank you for joining us tonight. So excited to get to chat with you and trust that everybody on the call is going to just love the chance to learn from you as I have. So I'm just gonna, start out. Kimberly, Kim, I would love to hear from you. What are some small signs that help you know? And actually, you know what? I'm gonna pause because I actually would like you all to introduce yourselves first. Before I do that, I apologize for sort of disrupting the flow. Maybe we can just each go around real quick. So everybody, I have had the chance to meet you, but not everybody on the call has. So maybe Kim, you could start out with just a brief introduction first.
Sure. Thanks, Laura. Hi, everybody. Thank you so much for being here tonight and for recognizing how important family experience is with regard to patient safety. I am a mom of two, and my son Jake, 12 years ago already, was critically ill with complications from E. coli infection, and he spent 101 days in the PICU at Weill Cornell Medical Center in New York City, and subsequently has some chronic health conditions. We will be going up to Boston Children's Hospital next week for his 6-month checkup with his GI team. So we've just been navigating this for a long time. And in order to make sense of everything he went through, I decided to become an advocate and volunteer with the Family Advisory Council at Weill Cornell initially, and I've been involved with some other more broad organizations like SPS and the Society for Critical Care Medicine. And I just really enjoy trying to make lemonade with the lemons that Jake was handed. So thank you for having me.
Thank you, Kim. Andre, how about you?
Hi, my name is Andre. I am a patient at Dayton Children's Hospital. 25 years ago, was diagnosed with sickle cell. And so I have, over the course of my life, kind of dealt with that and been seen at Dayton Children's by multiple different providers. But over the course, I realized that I needed to not only advocate for myself, but also advocate for others. And so that's something that is really, really important to me, is making sure that I am being a role model to people that are also diagnosed with sickle cell or even other critical chronic illnesses. Sorry. Because I think it's really important that people have someone to look to, which is something that I didn't have, something that my family didn't have. And so my mom and I have kind of started to advocate, and that is why we're here. That's why I'm here.
Thank you so much, Andre. All right, Cody.
Absolutely.
Hi, my name's Cody Mathis. I am in Columbus, Ohio, and I have a daughter and a son. My daughter was born Group B strep positive because my wife was falsely treated negative when she was positive. She started her life in the NICU with a PICC line and lots of ups and downs. Fast forward a little bit later, she was diagnosed with pediatric feeding disorder, pica, a global developmental delay. A little bit later, she was diagnosed with autism. So just a lot of appointments and a lot of unknowns that we had to travel to lots of doctors to figure out. We had our own little bingo card for the hospital to try to figure out what we were doing. So, she's my perfect little girl in a very imperfect world. So I have done everything I can to uh, learn and advocate for her and others that are in the same position. I am on the Family Advisory Council at Nationwide Children's Hospital. I'm on a advisory council for our County Board of Developmental Disabilities. I just throw myself into absolutely anything I can that will help her and help others make her life a little bit easier.
Thank you, Cody. Great. And last but not least, Hannah and Jeremy, you can either both or one of the two of you do a little introduction as well.
Having issues with her unmute. I'm Hannah. This is Jeremy, my husband, and we were kind of thrown into the medical world about 4 years ago when our daughter was born. We have 3 kids. Our daughter's the youngest. Our boys are a little older than her. And we had no idea that she had any challenges when she was born. And about 3 months old, she was diagnosed with an ultra rare syndrome called Pallister-Killian syndrome. She's one of 500 in the world to ever be diagnosed, past and present. And yeah, it was a very challenging first year. I think we had over 150 appointments within the first year. Our daughter is in 19 specialty offices in the hospital and 4 different therapies. So her syndrome affects pretty much all parts of her. We are very involved at Akron Children's Hospital in Ohio, as well as Cincinnati Children's, and then CHOP out in Philadelphia, Children's Hospital of Philadelphia. They have what would you call it? Like a specialty clinic for this specific syndrome. So we've been able to meet some families through that. And then recently we joined Akron Children's Parent and Family Advisory Council. So we're kind of in the process of getting onboarded there, and we are hopeful to continue to advocate for more at Akron Children's.
Yeah, we've been a part of advocacy for probably 15 years now. Worked on the west side of Chicago for a number of years, doing different after-school programs and mentorship and community development, gang intervention. So advocacy was kind of in our blood. And when our daughter she was born and was diagnosed with all these different things, we've just kind of pivoted in that direction. So we're happy to be here. Thanks for having us.
Thank you all. Wow. I know that everybody else, I'll just speak on behalf of all of us listening to you all. Like, this is the group of experts. So thank you for joining us for sure. So let's start out. Kim, I'm going to start with you. And I would love to have you talk a little bit about some of the small signs, the little things you notice right away. If a children's hospital environment, as Jake was receiving care, as you've gone back for various reasons, what are those small signs that help you know if a hospital feels safe or not safe?
Kind of a loaded question there. So I just want to backtrack quickly. A lot of Jake's chronic conditions now were due to medical error, but I want to more say oversight. Like things just weren't noticed because there were other more critical things happening. So the medical error and the safety has kind of been a part of our story from the beginning. So my absolute number one thing is friendliness and relationships. Um, Bimpe, you beautifully talked about trust and how every interaction is either an opportunity, I think you said, to create or to break trust. I think that I've experienced both, a freestanding children's hospital like Boston Children's, just for an example, and then Kamansky Children's Hospital, which is at Weill Cornell, which is a hospital within a hospital. I definitely think freestanding children's hospitals are at the advantage for this because everything is geared towards children. But I just think from the minute you walk in, reception, security, everyone's demeanor has an impact on you because you're only, when you're a parent, even if it's just a routine checkup with your child who has these chronic illnesses, you're in a heightened state. You're always on alert. Um, so little things that might not kind of bother you on a typical day, if you're in a heightened state, I think that you are more apt to react to the little things and to feel the little things. And children perceive everything. My day job is a preschool teacher of children with multiple disabilities, and they are, I'm sure Jeremy and Hannah can attest that Amani is very perceptive and you can sense who she trusts and who she gravitates to. And Cody, you may feel the same for your daughter as well, verbal, nonverbal, whatever the case may be. Children pick up on this. They feed off of that energy. So I really do think the number one thing is trust and relationships and making someone feel emotionally safe. Because again, parents are always in a heightened state when you're meeting them in an ICU or in a hospital setting. So I think that it's just important for clinical staff to and even support staff to be cognizant of that fact and to really be mindful of interactions such as that. Even just background chatter, about your weekend. Nurses, want to chat at the nursing station, and you're hearing these stories while your child is, suffering, and all these little things, you know, help you either feel safe or not feel safe. Um, and I also just wanted to note that, as a clinician, you're in the hospital every day. This is work for me, it would be my classroom. But, for parents, even parents of frequent flyers to the unit or to the hospital, it's not a natural environment. There are things that have um, almost like a association of like a PTSD, for children or for parents. I particularly had a student who I couldn't change her on my changing table in my classroom because it reminded her of being on the table in the doctor's office. We had to change her on the floor. So these little things, and going into that, I really think that um, a big factor of safety is when the staff from the get-go um, can acknowledge the family and defer to the family as the expert on their child. While clinicians may have clinical expertise in, the diagnosis, not every kid read the textbook. Their diagnosis is not linear. It's not something that you can necessarily learn about when you're in medical school or, just because another patient's similar. Like every child is a little bit different and has their own set of nuances, just as any typically developing child does as well. But when you have, especially children with medical complexities, I think that asking the parent questions right off the bat and talking to the parent, even acknowledging the child when it's appropriate, I think that leads to that trust and that feeling that the parent is really part of the care team and is an important part of the going to be an important part of the decision-making process, throughout any of it. Um, I also obviously cleanliness is a huge thing to me, especially after basically living in a PICU for 101 days with my son. When we get checked into hospitals or if we're going for outpatient care or blood draw or anything, I think cleanliness, the cleanliness of the room, hand washing upon staff entering and exiting the room. One of my biggest pet peeves is when nurses prime an IV over an open garbage can. For me, that just like sends a chill up my spine of just the possibility of, yeah, I don't know. For whatever reason, it just feels very unclean and unsafe to me. Um, s- you know, just just kind of like any kind of sloppiness, or if someone's coming to put an IV line in and they have everything kind of in a chuck and then they throw it on the bed to start doing the line, like these things get picked up by parents, and there's almost that feels cavalier, like, oh, here, I'm going to go do another stick or another. So I just think that being conscious of that for clinical staff, how you present yourself and how you even just present the materials that you're bringing in, whatever um, medication or supplies, I think is really important. Um, and just one other thing I wanted to mention is the timeliness of attention is a huge factor in feeling safe. I know that nurses have, you know, overloaded caseloads, doctors are in and out, and everybody has, you're at work when you're a clinical staff. But to that parent with that child, their child should be your number one priority in their mind, because in their mind, it is the number one priority. And of course, everyone understands that there's always going to be someone who's more critical or needs, more attention more quickly. Um, However, I think that the delivery of care and the timeliness in which a family is attended to also kind of sets the stage for that trust and feeling of safety.
Hmm. Great points, Kim. Yeah, I think, really sticks out to me connection and the power of connection and building trust, and the little moments that can build that trust over time, and how to take those as healthcare team members. Little bitty things can make a big difference in terms of deposits and building trust. So really appreciate those comments. So I think this is a fairly related topic that I'd love to get you to weigh in on, Andre. Um, can you talk to us about a time when you maybe felt more safe or less safe because of how you were treated?
Yeah, when I think about a time that I felt more or even less safe because of how I was treated, it reminds me of a particular inpatient stay that ultimately came down to how we were being communicated with. I remember an inpatient stay where I was experiencing a lot of the same symptoms as a recent previous admission where I had sepsis. That first experience was really scary, and it was pretty serious. Over 25 years, I'd probably say that that was my scariest admissions that I've ever had in my life, which I think probably says a lot. I'll skip to the good part of this admission. And like, I'm here. It went well. I got treated, and I recovered. Um, Considering how bad I felt during that stay, it didn't necessarily feel like that was the route we were going, right? But a couple months later, during a different inpatient stay, it started the same exact way as this first one, right? My body wasn't responding to the meds that should typically fight illnesses, or even pain, or even the infections, things like that. My mom and I tried to communicate that concern to our care team. We just said something simple, right? Hey, this feels a lot similar. This feels really similar to what we've previously been through during this inpatient stay. And like trying to bring up that point. There was a point where it didn't feel like that concern was being fully heard. In that moment, even though I was in a hospital and surrounded by professionals, I didn't feel safe. And it's not because people didn't care, but because there was a disconnect in the communication that was happening, right? I didn't feel understood. I was told the symptoms that I had didn't matter because of my age, when in all actuality, those exact symptoms were actually notable concerns considering my previous health, and my diagnoses, right? What largely shifted that trust or that inpatient stay from feeling less safe to feeling more safe was when my nurse like slowed down and she advocated for me. And she helped escalate those concerns to the right people. And she even reminded me that there was a line, I think in our hospital, it's like I can't remember the name of it, but there's a line that is fully staffed with other providers if I felt I needed to get another opinion or someone else to come and help us out in the situation. When she like took that time to really listen and engage what my mom and I were expressing, the feeling changed, right? We called for other people to kind of weigh in on this, and we felt more supported and included, and ultimately we felt more safe.
That's so,
Um,
oh, sorry to interrupt you. I'm
I'm so
excited about
sorry.
what you just said because I
Yeah,
just feel like the power of a person, in one person, like
yeah,
taking
absolutely.
the extra moments, like so impactful. And I can just hear it in your voice, how much of a difference
Yeah,
that.
yeah, I'll definitely always remember her, right? In that situation, I largely felt helpless, right? I felt like I was talking to a wall. And I knew that these people, like I've known them, right? But it just didn't really feel like it was clicking. What stands out to me largely about this situation is even though the final diagnosis did end up being different, that didn't change how I felt about the entire process, right? It didn't change how I felt I was treated. And so for me, safety isn't just about the outcome. It doesn't matter that the final diagnosis was different. Um, it's about being heard and being respected and being included in on the conversation, letting people know what you're thinking, letting me know what you're thinking, especially as a person that is completely engaged in my healthcare. I like to know what we're considering and things like that. But when communication is strong, I feel as if trust is built. And when trust is present, that's when I truly feel safe.
So many good tips. I'm hearing the trust theme come through. I just typed myself a note. It's not just about the outcome, right? It's very easy for us, especially in that safety space, to be explicitly focused on the outcome, right? And
Yeah,
that matters, but the reality is how the person feels through the experience is profound, and trust in the system and how that relates to future experiences. So I just love those tips and bits of wisdom you've shared with us, Andre. Thank you so much. And Cody,
absolutely.
this is actually like I feel like we're just like right on the path here of, the next question that we were kind of talking about was around kind of that there's similarities, but also perhaps differences between being safe and feeling safe. And as a family member of a kiddo who has high medical complexity, I'd love to hear about your perspectives on what the difference is between sort of being and feeling safe as a family member.
Yeah, and it goes hand in hand a lot of the time. I think back to my daughter's birth. Again, um, my wife was treated as negative for group B strep when she was actually positive. So from my daughter's birth, she was, because of a medical error, in the NICU fighting an infection that she should never have had to. So her physical safety was put in jeopardy from the beginning. Um, and when you look at the two, there's being safe, there's security regulations, staff training, continued education, recertifications. You think intent versus impact. What am I doing and how is it going to work? This is what I want to do, but how is it going to be perceived? Then you can move down to feeling safe when you think of emotional safety, patient family centered care, which patient family centered care makes emotional safety 10 times better. When everything is going well and the patient and the family are all in the loop and they're feeling uh, trusted and loved and safe, it makes everything go better. And you think of using the correct specialties. So you have your child life specialists, your patient engagement. At Nationwide, they have butterfly palls. Um, there are times and place where those are amazing and needed, and there's lots of times that they're asked for and pushed off because of timing or sometimes you ask for a child life specialist for an IV, and the nurse is a very proud nurse who is very good at doing IVs, and she doesn't want to, take that step off to help. And it's hard. We had an experience about a year ago where we were admitted, and my daughter had to have her nose sucked out regularly, nasal aspiration. And we asked for the first time it happened, we asked for Child Life to come in or for my wife to help do a comfort hold. And the nurse said, she does it a certain way every time, so that's how she's going to do it. And she essentially wrapped her in a blanket on the bed and sucked her nose out. And to this day, my daughter has trouble being on her back. We had to drop out of swim class. She can't have her diapers changed while laying down because anytime she's on her back, she has a complete meltdown. And it could have been avoided with, a comfort hold or a proper specialty, or just listening to the parents who have been here before and known what was happening. But instead, we had that experience, and here we are a year later still doing it. And the big thing that I think of is feeling safe and patient safety of being safe. They can go hand in hand. Like if you do a comfort hold, by them feeling safe, they are being safe. And it all can just mesh very well. Versus, really trying to focus on one thing, and your emotional safety gets brought down because of pride or timing or anything. A lot of these medically complex kids, their parents know exactly what they need when they walk in. They know what they need before they're even there. Some even call in beforehand to state exactly what is going to be needed. And when you get there and you have someone that doesn't listen, it really brings it down immediately, and it can really hurt the entire stay or experience. So I think patient safety, family-centered care, emotional safety.
Thank you, Cody. That's really a profound example that you provided of, I'm a nurse. Like I have I remember those days of working the bedside and like the efficiency, like I got all these things on my list, right? And I can imagine the situation of this nurse being like, I got the tasks to do, right? And I'm good at this. I do this all the time, but not understanding the significance of that impact on your family's life, not just in that moment, but in the long term. And so I just really appreciate you making that connection between taking those few moments up front to slow down, to listen, to make accommodations where possible, can pave the way for things going so much better in the long run. Relatively small investment for massive gain across the board, and just really appreciate how you described that. So thank you.
A couple moments can set the course for everything, good or bad.
Yeah, so true. All right, so we've talked a lot about kind of this, so what it looks like, what it feels like around safety for families and patients in the healthcare setting. And, we in healthcare often talk about like, speak up for safety. We want to like hear your perspectives, and we want to know what you have to share. And it's also worth acknowledging that sometimes the context makes it easier or harder to be that voice, to advocate on behalf of what your needs are. And so I'm curious, Hannah, if you might be able to talk a little bit about what makes it easier or harder for you to speak up in the healthcare setting when something just doesn't quite feel right about what's going on.
Yeah, it's a big question with a lot of different factors into it. I think as a parent, it will always be difficult to speak up and advocate when admitted because, like Kim had shared before, we're not our best selves when we enter into the ICU or when we're admitted to the hospital with our child that is going through potentially a life-threatening situation. We're exhausted and overstimulated. We're likely in fight or flight mode, and we're trying to attempt to seek out the best care possible for our kids. So it is a hard, very difficult thing just from the get-go to be able to feel safe, to be able to speak up for the things that we need for our child's care. With this being said, there's probably this inevitable tension that might be possible between the parents and the providers that are there regarding the child's care. And I wanted to talk about a couple elements that we feel like are important or that have arisen when we are admitted to the hospital, regardless of what hospital system we're in, that have allowed for the environment of safety and belonging to be there in order to allow us to feel as if we can advocate or we can voice what we need for our child. The first was just setting a foundation of safety before something happens. So that's from the get-go. When you enter the room, when you enter the ICU, you enter an admitting room and you're joined up with a nurse or somebody from vascular access who's trying to get an IV line. That from the get-go, they're working towards setting this foundation of safety in relationship. I know this has been talked about before, the feeling of safety and being safe, that just happens through relationship with people. That the person in the room who's the professional and does this every day is meeting up with somebody that might do this often, but this is, a situation where they're in crisis and they're walking through that. So how can we create that environment from the beginning before something else happens and we're having to navigate that? And then the second thing is creating a team mentality between the parents and the providers, thus lifting the parents as like an integral part of the decision-making process. That they are some of the best players on the team because they're doing this day in and day out with their child. So practically, I kind of wanted to talk about what those two things look like, both setting a foundation and what it looks like to build this team mentality between the parents or the caregivers and the providers. Jeremy is going to talk in a little while just about the importance of developing happy, healthy nurses within the hospital system, who in turn are the parent or caregiver's best advocate when they're in a scenario at the hospital. We have found that those that come to our level and sit down beside us, the worn out parent, as they fight back tears during a tense admission, or who offer compassionate listening ear, that they've done the work to get to know the parent or caregiver, that those are the ones that are going to advocate for us and for our needs. So developing that, I know, like I said, Jeremy's going to share more about this, but these are the kind of nurses that can kind of smooth out the systems and create safe spaces for the parents to thrive while they're being admitted. Secondly, just reminding the providers, so the doctors, the residents, the nurses, the whole care team that comes in to care for the child. And I know this was mentioned before, but just the reminder to those that are serving the family that the parents are the professionals of the child. A simple phrase that we hear now and again, not all the time, but now and again, and has made a world of a difference for us, is when a care or a provider says something along the lines of, you know your child the best, that you know what's best for your kid. And they're affirming your caregiving skills for your child in particular. Again, like it was said before, not every child, even if they have the exact same syndrome, illness, chronic condition, is going to be treated the same way. There's things that the parents know, these hints and these movements forward that will help the child progress if there's a listening ear of a provider willing to sit and listen and hear them out. So you know your child best is a phrase that can go a long way in that situation. And then I had mentioned this, listening and respecting the parent's suggestions and thoughts on how to care for their child specifically. So again, the affirmation allows there to be this team mentality between the parent and the provider, that as I think especially in regards to parents that have children with complex needs, there might not just be one simple thing going on with the child, but there might be 5 other things that we're needing to pay attention to as we're navigating the thing that's overtly the problem. And so being able to give them a voice into that allows there to be, you know, this camaraderie in the group as we work towards figuring out what needs to happen with the child. And likely the parents have probably walked through these situations before with their kid, and they just need somebody to listen to them. Because like Cody had mentioned, a lot of times as parents, we're calling beforehand to palliative or to the ER and saying, hey, this is what we need. Are these things in place so that we know that when we bring our child, they will be safe? I think Jeremy's going to talk about this, but we've navigated this a little bit in regards to vascular access at our hospital in particular. Where we needed to call to make sure that our child was safe, to know that there's going to be somebody that can get access to their veins to get the appropriate care for her to move forward in a way that will benefit her. A few other points on setting this foundation of safety and creating this team mentality is just asking questions to the parents so that they feel like a priority in their child's care, which kind of goes in tandem with these check-ins with parents. We're treating the child at the hospital, but the parents are directly experiencing this along with their child, almost on a deep internal level. You know, they're feeling this emotionally, they're seeing their child physically walk through the scenario. So just a provider that's able to check in with the parent, get on their level. If the parent's sitting down, sit down across from them. If they're standing up, meet them in that stand up, you know. Incorporating phrases like, how are you feeling about that suggestion? You know, if a new medical suggestion was offered to the family, or what other thoughts do you have if there's changes in the care? Another one that goes a long way in allowing parents to feel safe and being able to advocate for their child is when the provider, you know, allows themselves to humanize, you know, themselves a little bit. They're not just a provider, but they're human walking with a child or with a patient, saying, if this was my child, I would. And it feels a lot more personal to say, okay, so we're not just thinking of this is just a patient that's coming in and is going to be released, but hey, I see you as a parent. I see you as a person. I see you as somebody, you know, walking through this tense situation right now. And if it was me, this is how we would navigate this. And it allows you to not feel overlooked in your thoughts, but actually be incorporated into the care that is being given to your child. And then lastly is just the action steps that are taken. If we are brave and stand up and say, hey, this is not going the way that we expect, these are some suggestions and things that we could see that would benefit our child or maybe change the trajectory of where we're going. If those things are listened to and the provider sits down and takes notes and cares for that, not to just show that they're taking notes, but then seeing that action taken afterwards and then experiencing the change, that makes a huge difference. Just that follow-up afterwards, you know, maybe at the next visit in the room, hey, I'm following up on this that you said, or I've checked in with this provider, this doctor, this specialist. This is where we're at in this. I think that allows the parent to feel that they have a true voice in creating change for their child in a way that benefits them.
That's, oh my gosh, like a treasure trove of little nuggets of wisdom there. Thank you, Hannah. It just strikes me how we're hearing so many common themes that are, between all of these stories. And you've given some really tangible examples of what does this look like? What does it look like to create a space where it feels safe to bring up hard things if I have to? And so thank you for sharing sort of those little bits of wisdom. So Jeremy, would love to have you weigh in. What advice, thoughts, additions would you like to add?
Yeah, and I'll reiterate, like it is difficult for parents, and this is not our day job, and we are walking in and we're grieving. And I think it's important to use that word, that the moment the parent walks in, especially in an emergency or at admission, we have lost something. Maybe it's just our expectations of what this next week was going to look like. Maybe it's a new diagnosis. And so there's deep grief going on in our hearts. And I think a lot of times providers don't realize that when they leave the room, we go to the bathroom and cry. We find a quiet place and weep, because this is either our child's body or it's our body. We're feeling this within us. And so I think it's just always important to remember that you move on to the next patient, which it makes sense. It's your job, but we are left with the consequences of what is occurring. So I think what hospitals can do, I've got 3 points. The first one is develop happy and healthy nursing staff. As Hannah said, we've all said, obviously the parent is like the best advocate, but we can only do so much. When we walk out of the room, it's not our system, right? And so a nurse is that next best advocate in this hospital system. Like I like to call them the heartbeat of the hospital. They advocate for you. They smooth out miscommunication, because as we all know, even outside of the hospital, miscommunication is a very common thing. But inside the hospital, when it comes to safety, miscommunication can be detrimental. And so nurses are there to smooth out miscommunication, and they speed up those slow hospital systems that just seem to take a very long time to integrate and connect. And the nurses can be the ones sending reminders, texting and saying, hey, where is my medicine? On and on it goes. So I think for hospitals, they should create structures and systems that develop happy and healthy nurses. And I am talking paid well. Just because if a nurse is paid well, guess what? They want to be there. This is a good job that they don't want to give up. I think appreciating and celebrating nurses in their care, patient care, and in their achievements is really great about creating this culture of celebration about nurses that do it well. And it makes others aspire to be like them. And I think also just providing top of the line, just mental health supports for nurses, because they are coming into constant trauma, a lot of things, especially if they're in these like ER settings or ED settings, ICU settings, like they're seeing it, and it does affect them. So making sure that they have the proper supports so that they can come in fresh, they can come in ready to go, and they're not burnt out. I think the other thing to create, that makes us feel comfortable speaking our concerns is trained to train and champion humble doctors. I think the word humility is probably, I don't know if they're taught that. I don't know if that's part of the education, but I think a good doctor is humble. And I think that's what we've all kind of said, because, a person that is humble is able to empathize. They're able to care. We know as parents that doctors are professionals. And believe me, we want professionals, because we want our children's care to be the best that it can be. So we don't necessarily need reminders that they are the professionals. We need them to remind us that they want us to be a part of the plan. And so even just a doctor walking in and saying, hey, I am so sorry, and this sucks. You have got to be feeling so much right now, and this is extremely difficult. And I just need to say, I'm sorry. I'm sorry that you're here. You don't want to be here. And we're going to do what we can. We're going to work together as a team, and we're going to figure this out together. Okay. I think educating and empowering the patient or parents with choices. A lot of times we feel like, well, the doctor said it and this is what I have to do. But if you give a parent a choice, or even include the patient in their choices, I think that empowers good critical thinking and good critical questions. There's a lot of different varieties when you're treating somebody, depending on of what you can do. And if there isn't a lot of choices, then I think it's always important to explain why. This is why I am telling you this is the best choice. Let me explain it to you. And once you explain it, making sure, do you understand? Do I need to say it in a different way? It's okay that you don't understand. This is, I think professionals forget that they use this language 24/7. This is all new language. I think you throw in families that are from different cultures that speak different languages. You just got to move slower. And it's not because the parent is stupid. It's not because the parent doesn't understand. It's because they have to play catch up, not just with English, but they have to play catch up with maybe even phrases and words, even in English, that we've never heard before. And so moving slowly, and also just cultural competency, cultural awareness. Not every culture is going to speak up, because different cultures have different ways of addressing authority. And so as a doctor, you're walking in as an authority, and some cultures will never question authority. But as a good doctor, you might want them to question your authority just to get something out of them about, how's your child gonna handle this? So just the cultural competency and good cultural training of the various cultures that are here or in your hospital is really important. A doctor that apologizes is my favorite doctor. I do not need a doctor that is perfect. I am not a perfect parent. I am not a perfect minister or ministry worker. I'm not a perfect father or husband. And so I don't need a perfect doctor. I need a doctor that when they're wrong, they say, hey, this was the wrong call, and I'm deeply sorry. And I'm going to fight to figure this out with you. We had a doctor at Cincinnati Children's that we had been discharged. My daughter had a laryngeal cleft surgery. We were discharged after I think a 3-hour stay or a night stay. They sent us home, and within 24 hours, we were back in the hospital because my daughter refused to eat, and she was eating by mouth at that point and not through G-tube. And so we got admitted then to back in Children's. And this doctor called us from ENT. He called us from Cincinnati Children's and got on the phone and was so apologetic and said, we shouldn't have let you go. It was too soon. I cannot believe you're in the hospital again. And I am so sorry. And explained kind of his reasoning, but was just so apologetic. And then with Akron Children's and worked in tandem with them just to support my daughter's care. And I said, man, like this man, he is humble. And he's a man that I trust. I want to follow because he's not afraid to say sorry. And I think also just reminding residents, I think new residents as they get trained, that they should be caring just as much for the parents as they do the patients. Obviously, residents are learning a lot. And so just a good reminder about bedside manner with residents. And then the last point is to take parents' constructive criticism seriously and actually do something about it. I'm talking document safety concerns very well. Have in-person conversations with a parent and then give them proper documentation. A letter in the mail is great that you heard my grievance, but a phone call shows me that you actually care, that you're actually going to do something. And then follow-ups. I think that when a hospital actually recognizes that this is a really big concern and a safety issue, and then they go above and beyond to not only communicate once about an issue, but then follow up and say, hey, I know we talked 6 months ago, and I just wanted to give you a quick call and let you know where we are in this process and that we are just actively working on it. And here's what we're doing. These follow-ups should be measurable and quantifiable, right? If I have to do that at my workspace and make sure that I'm meeting goals, then giving me a follow-up and just saying, hey, we don't really have anything to tell you. Like, I want, as a parent, measurable and quantifiable data that you're showing me you're actually doing something, right? I think telling me an action plan and telling me like, hey, these are our SMART goals. Like, these are our measurable goals. These are why it makes sense. This is how we're going to do it. Going above and beyond and communicating to parents like that, you're not only going to earn the trust of the parents, but you're going to earn the trust of everyone they talk to. Because they're going to say, man, this hospital does it well. Excuse me. And then Yeah, I think when you don't follow up, I think what it communicates to parents is that your concerns are actually not the priority of the hospital. So lack of follow-ups leave us a little empty. I think giving parents a place to communicate to higher up entities with their stories, I think has a great impact. I think the higher ups in the administration don't always hear that, and they don't hear the stories. And the reality is that that is where the money flows, and where the money flows, there the systems flow. And so, if you can get parents to actually share their stories with the people that are making the higher up decisions, I think that proves to parents that, man, they care about what we are saying. But I'll cut it there.
All right. Gosh, thank you so much. So much wisdom shared and practical uh, advice on things that we can do in our hospitals to really create a space where people are heard, where we are learning from the people who know best, where we are building respect and support for our families and patients in a way that we can all team together to make a difference. So, um, really huge gratitude to the five of you. I would love to, we could talk for another hour, I am certain of it. And there has also been a slew of amazing comments and questions in the chat, which I wish that we had time to get to all of them. Missy, I'm wondering if maybe there's like one that we might get to. I think that you've been kind of taking a look at the chat. Is there anything that we might pose to one of our
Yeah,
panelists?
Andre, you have a question in the chat. They want to know how parents can teach their children how to advocate for themselves while they're in the hospital.
Yeah. When I love this question. And when I think about that, I think about what my mom did for me. And my mom was always really transparent about what was going on. And my mom, she, outside of sitting in the room, like if we did rounds and it was like, hey, here was this, right? It'd be cool. Hey, what did you understand about that? And then it's like, cool, this is what is happening. Maybe I was right, maybe I was wrong. But here is what they just said, right? Um, and then I always had the question, my mom always had the question for me of, what do you want to do? I think that that is really, really helpful for creating a patient, for creating a space where your child actually feels like they're heard. If I was like, "Hey, I hear what the doctor said, but I just hate that." For example, I have a really quick example. I needed, this is completely outside of sickle cell, but I needed braces, and my orthodontist doctor, he wanted to break my jaw because he just said it wasn't aligned perfectly. And my mom looked at me and she goes, "Hey, like, what do you want?" I didn't want another surgery, right? I've just spent 25, okay, at the time, it was like 16 years of my life being chronically ill, having surgeries and all of that. I don't want surgery to break my jaw. Like, I don't care about that enough. And so just allowing that space for whether you're like, hey, yeah, I'm going to take your opinion or not. Because like, well, you need surgery, you're going to have that surgery, right? That has to happen sometimes too. Um, but creating that space where the child feels heard, and getting them to say those things to the physician, how to word that in a professional manner that is going to be received well, or maybe it's not even received well, but received by that care team, I think is important.
Your
Great
mom,
question,
what's your mom's name, Andre?
Jules.
Jules sounds like a wise woman. I
I
love
like
it.
to think so.
Yeah, yeah. Oh, thank you for sharing that. That's wonderful. Kim, did you want to chime in with something before we wrap up?
Yeah, I just wanted to say, a lot of us are talking about what hospital staff can do for us, but I also think for the parents who are on this call, and we've said it a few different ways, but we're not our best selves, I think, as Hannah put it. And I think that it's important for us to also remember that relationships and respect are a two-way street. And as upset or frustrated or however we may be in the moment, I think that the way that we also interact with the hospital staff and the people caring for our children is is of equal importance in building the trust because it's a two-way street. So I don't want to put all of the onus just on clinical staff, doing things for the family. I also think it's important that the families remember that, how we present ourselves is equally important.
Yeah, thanks for that, Kim. And truly, thank you to the five of you. What a gift. As I said earlier, it is we know that your journey is more complex than many of ours, and what a wonderful treasure for us to be able to learn from you and your experiences. So thank you for sharing your wisdom. Thank you for going above and beyond to advocate on behalf of hospitals and systems that make it easier for us all to provide and receive safe care. So huge thank you to the group of you. And I'm going to pass it back over to Missy.
Thanks, Lara. I want to go ahead and and thank you, panelists, all of you. I enjoyed hearing all of your wise wisdom, and there's a lot in the chat, so we will definitely get all of the kudos and all of the different questions to each of you. For our gift card drawing number 3, we have Michael Albrecht with Seattle Children's is our next winner, and then we have Rachel Candelario from Rady Children's at Orange County. And now we're going to turn the tables on all of you. We want to ask a question of the participants. And I'm going to ask you to raise your hand, and I'll call on one person to answer it. And for the rest of you, you can put your answers in the chat. The question is, and this was actually a question that someone submitted when they registered for this webinar. What are the most effective ways patients and families can raise safety concerns in the moment without fear of being dismissed or labeled as difficult? This one's to the audience.
Can you please put it in the chat?
The question? Yes. Jesse, do we have anyone with their hand raised yet?
Yes, I'll go by how it's listed on my screen here. So Phyllis Mesco.
Hi, I've been a nurse at Children's 55 years, and my son with autism is 41, and my daughter got diagnosed at our hospital with MS at 18. And one big thing, I went through everything I heard, and what you've gone through, have wonderful ideas, but one thing is to treat your patients like your own. You want your patients to feel that this is what you would do if that is your child or your grandchild. And everybody has a good day, everybody has a bad day, but you still have to understand, like I heard, when you walk in and your child is ill or disabled, you come in, not necessarily some nurses I'd hear say, well, that mother has an attitude. No, she doesn't. She's scared. You know what I mean? And she's defensive, and she's going to be defensive for her child. And it's not that, or they'll say the word frequent flyer. That would make me crazy, because you think they want to be there every day, every week? No, and so many of the things you talked about, I have preached and talked about there for years, before there's air conditioning, let's put it that way. But you have to treat them as your own. You have to understand these parents are stressed. You have to look them in the eye. You have to explain that you know this, offer them something to drink, offer them something for their child, offer for them to go get breakfast or go get a cup of coffee. And if you have a chance, get a volunteer, get a candy stripper, somebody to sit with their child if you can't be there. And it cannot be, this is how we've always done it. And yes, we always had ways that we would do a procedure, but you need that parent there. One quick thing, years ago when my son needed x-rays, I used to always get pictures of him at Christmas. Years ago, we would take you to Penny's for a picture. My son needed an x-ray. I had a patient. I had to go on my break. As I ran downstairs, I could hear them saying to Mark, we're taking a picture. We're taking a picture. And I walked in, and he's strapped down with adhesive tape, all the way around. Do you know that son of mine never took a picture after that? Years. I mean, even to this day, I will say to him, he's not rubber teeth, Mark, teeth, but he never would, because this is what ended up happening with things like that. So thank you very much. This is very interesting. I hope you're okay with my comment.
Thanks, Phyllis. Tiffany, we have time for one more quickly, and then we'll go into a word cloud exercise with everybody.
Yes. Can you hear me? Okay. Yeah, I think what's so important is, I think it was kind of touched on before, is understanding that the parent is truly the subject matter expert in their child. And just although physicians may have credentials behind their names, those parents that are working day in and day out have the expertise. They may not know how to articulate it as eloquently as someone who has been through 12 years of school, but they are the subject matter expert. And so when they are bringing a question or a concern up, just have a listening ear. Don't come in with biases, because we all have them. And treat them fairly. And I think someone else said it, treat them as if it was your child, and remembering that you're not just dealing with the patient, but the totality of the family itself, and trying to address the caregiver's concerns and needs as best as you can.
Thank you for sharing that. I agree. And again, there's some more in the chat, and some ideas as well. Thank you all for that. I think now we're going to do, we want some more feedback from all of you. We're going to do a word cloud. And the question is, which actions matter most to you when deciding if you feel safe at your children's hospital, whether it's inpatient or outpatient? And you can just put whatever word comes to mind. Jesse's going to put the instructions of how to use the polling. It'll go away quickly, but then it'll come back. So don't worry about that. So you can scan it with your phone, or you can type in the pollev.com/CCHMCAC, and you can send a code of 54575, and the message is 22333. And if you can't get it to work, you can always put the word in the chat too. I'll tell you mine. Mine's communication.
Missy, I'm getting a note that it says it's waiting for the presentation to begin. I'm not sure if others are having the same experience.
Okay, Jesse, she's probably trying to troubleshoot.
Yes, I am. Give me just one moment. I apologize.
How about we do the next gift card drawing while we're waiting? Does that sound okay? So the next two winners are Jen Chandler of Prisma Health in Columbia, South Carolina, and Nancy Santana of Children's Hospital of Philadelphia. And I love seeing in their eye contact, compassion, in the chat. Body language. Here's the word cloud. So we've got communication, empathy, listening, comfortable, warm, trust, attentiveness, consistency, heard. I see smile in the chat as well. Kindness, recognition, attentiveness. The big one so far is empathy. And I've seen a lot of empathy in this chat tonight, so thank you all for that. Child first, comfortable. So I think we've got our four big ones, which is listening, communication, compassion, and empathy. And then it looks like kindness is coming in there as well. Jesse, do you think that we've got a lot of input there?
Yeah, this looks great. We'll make sure to get a screenshot of this and follow up with this later. But thank you all for participating.
Thank you. And thanks for managing the technology, Jesse. It's always a worry that it won't work, but it worked. And with that, I want to go ahead and introduce Teresa Prouty, and she's going to give our parent story. And we'll let this slide get through. We already did the drawing. So one thing I hope healthcare teams remember from tonight. So I'm going to go ahead and turn it over to Teresa.
Thank you, Missy. And again, thank you to everyone who's taken time out of their evening to be here. I'm Teresa Prouty. I'm a family partnership coordinator for Dayton Children's, and I have 3 young adults, all who have multiple diagnoses, either medical, developmental, or behavioral. So thank you to our safety leaders, safety champions, and our patients and families for being here and for the important role each of you plays every day in keeping patients, families, and staff safe. We truly do appreciate your time, your voices, and your commitment. The SPS Safety Symposium gave us a great deal to reflect on this evening. Today, though, I want to focus on what I hope each of you walk away with. One of the strongest themes throughout this symposium we heard from patients and families was the idea of speaking up for safety. Speaking up sounds simple, but we all know it isn't. It takes courage, it takes trust, and it takes a culture where people truly believe their voice will be welcome, respected, and acted upon. As patient and family engagement leaders, the tone is set for that culture when we partner with our safety leaders. But speaking up for safety cannot live only within our teams or within staff-facing structures. If safety is truly our goal, then patients and families must be part of the safety conversation from the very beginning, not after something goes wrong and not as an afterthought. Families are with their children more than anyone else. They notice changes first. They see the gaps, the workarounds, the confusion, and sometimes the near misses. When we include them early, when we invite them in as partners, we don't just get feedback. We gain insight that can prevent harm. One of the most powerful messages to come out of the Safety Symposium was that patients and families want to speak up, but they often don't feel safe to do so. They worry about being labeled difficult. They worry about hurting relationships. They worry about consequences for their child. That should stop us in our tracks. Because if people closest to the patient don't feel safe speaking up, then we still have work to do, no matter how strong our policies are or how good our data looks. True safety culture is not defined by dashboards or committees. It's defined by whether a parent feels comfortable saying, something doesn't feel right. Can you double check that? Or, I'm concerned about my child. And here's the key takeaways I hope you leave with today. If patients and families are not included in your safety work from the beginning, your safety work is incomplete. Not consulted at the end, not invited once decisions are already made, but involved early when problems are being defined, when processes are being designed, and when solutions are being tested. The partnership doesn't slow safety work down. It strengthens it. It makes it more real, and it makes it more effective. Which brings me to a very practical, very important call to action. If you walk away from today and you do not know who your patient and family engagement leader is, or who your safety leader is, I urge you to make that a priority starting now. Every safety leader should be in regular partnership with their patient and family engagement team. They are not just a nice add-on. They're not a side resource. They are essential partners in safety. If you're unsure how to involve families in safety work, that leader can help. If you're starting a new initiative, they can help you engage families in meaningful ways. If you're trying to understand why something isn't working with families, they can bridge the gap. Safety improves when we stop designing for families and start designing with them. As safety leaders, as leaders, we have the responsibility and the opportunity to model that partnership, to normalize family voices and safety conversations, to make sure speaking up is expected, supported, and celebrated. Imagine a culture where families know from day one, your voice matters here. You are part of the safety team. And when you speak up, we listen. That is the culture our patients and families and each of our safety leaders deserve. That is the culture safety leaders help create. And that is the work that continues after the SPS Safety Symposium ends. Thank you for your leadership, your openness, and your commitment to safer care for every child and family. And thank you to our patients and families for being here today, for taking time to learn how your voices help shape and strengthen the safety work at your pediatric hospitals.
Wow, thank you, Teresa, for sharing that. And there's been some nice things in the chat too. I think next we're going to do a quick drawing for the next gift card winners. We have Suzanne Delascar from Holland Bloorview. So if you're here, go ahead and put your name in the chat. And to wrap us up, I echo what Teresa's saying. Thank you all for taking time out of your busy day and caring for your families to spend with us. We do want to hear from you. We did get a lot of questions submitted at registration, and there were some here in the chat. We will make sure that we answer all of them. We do want to hear from you as well. So there'll be a survey that's sent out, and we are expanding beyond Ohio. As you'll see, as you notice, there's representatives from different hospitals outside of Ohio. We are also looking for people to help with the planning committee for the symposium. So if you're interested in joining us and working with Teresa and Nicole and the whole gang, please send an email to SPS. Our email address is ochsps@cchmc.org, and we'll put that in the chat for you. So for patients and families, there's a QR code for you to scan for the survey. We can also send it via email as well. If you're like me, I'm technically challenged sometimes with those. And with that, Teresa, Nicole, Jesse, anything else we want to say before we do the last? Oh, we want to say a thank you. We would definitely want to thank the people that you see on this slide. They are part of the Patient and Family Engagement Planning Committee. Gotten to know a lot of them over the past year and over the past couple years, some of them. So I want to thank Joy Burt and Micah Cheshire at Akron Children's, and at Cincinnati Children's, Carla, Emily, and Janita. And then at Nationwide Children's, Laura Road as well. So again, we've got one more drawing. Thank you again for being here. The last drawing is for, let's see, Kaylee Barton of Gillette Children's, and then Cassie Quinn of Dayton Children's is our last winner. I hope that you all have a great evening, and we're excited to see you all next year at the symposium. We'll hold it around the same time of the year. And thank you, and go hug your children. Have a great evening.
Thank you, guys.
Stay safe.